name is Claire Kittner. I am a physician assistant in the Dumoulis Center for Cardiac Arrhythmias at Massachusetts General Hospital. You were referred to the Cardiac Arrhythmia Service because you have an abnormal heart rhythm. You are in a population at risk for dangerous heart rhythms from the bottom chambers of your heart, and you need a defibrillator to shock your heart back into a normal rhythm should this dangerous rhythm occur. The type of defibrillator you will receive sits underneath the skin rather than inside the heart. This video will outline the necessary steps you need to take before you come into the hospital for your scheduled device procedure, as well as what to expect before and after. First, lab testing and a chest X-ray should be completed within 30 days prior to your procedure. We prefer these to be completed at least 1 to 2 weeks prior to the procedure. This way, if there are any abnormalities, we have time to address them beforehand and repeat testing. These labs and imaging studies will be ordered by a provider to be completed at an MGB facility. One of our team members will call you before your procedure to outline all of the necessary steps to complete this testing. You will receive a call from one of our nurses the day before your procedure to specifically review medications to hold, what time to come into the hospital, and where to check in. Please note, if you use Patient Gateway, the time associated with your procedure may not be accurate. Additionally, if you have an allergy to contrast dye, you should notify your doctor before your procedure, as you may need to be pre-medicated to avoid a reaction. The day before your procedure, you will need to stop eating solid food as early as 10 p.m. You can only drink clear liquids up until 1 hour prior to arriving to the hospital. Clear liquids include Gatorade, Powerade, Pedialyte, apple juice, cranberry juice, grape juice, water, regular or diet soda, black coffee, or tea. Do not drink milk, cream, or non-dairy creamer. Your procedure could risk getting canceled if you have solid food or non-clear liquids in your system. If you are diabetic, drinking a clear liquid with sugar up until 1 hour before you arrive to the hospital is important to avoid low blood sugar. If you are on a blood thinner, such as apixaban or Eliquis, rivaroxaban or Xarelto, or dabigatran or Pradaxa, you will be required to hold your evening dose the evening before the procedure and your morning dose the morning of the procedure to reduce the risk of bleeding. If you are on warfarin or Coumadin, this can be continued without any missed doses. However, you should have an INR level checked once a week for 3 weeks prior to your procedure to ensure your levels have remained therapeutic. If you have your INRs checked at an outside facility, please bring in a printed copy of your INR levels when you present to the hospital for your procedure. After your procedure, our team may elect to have you hold additional doses of your blood thinner, depending on how your incision site looks. If you are taking canagliflozin or Invokana, dapagliflozin or Farxiga, or empagliflozin or Jardiance, please hold 3 days before your scheduled procedure. If you are taking erdagliflozin or Stiglatro, it should be held 4 days prior to your procedure. If you are taking a GLP-1 agonist, such as semaglutide or Ozempic or Wegovy, exenatide ER or Bydureon, dulaglutide or Trulicity, albiglutide or Tanzium, or tirzepatide or Mounjaro, it should be held for 1 week prior to your procedure. It is also important to notify your endocrinologist about the need for holding these medications 1 week prior to your procedure so they are aware. If your doctor has instructed you to hold any other medications prior to the procedure, please do so as well. Other medications that can interact with anesthesia are also typically held the morning of your procedure, like blood pressure medications, diuretics or water pills, and medications that affect your heart rate. If you need to hold any additional medications the morning of the procedure, our team will let you know when we call you the day before. On the morning of the procedure, when you arrive to the hospital, you will meet with your care team. This device implant procedure is usually performed under general anesthesia or with higher doses of sedating medication, meaning you will be fully asleep for the procedure and may require a breathing tube to support your airway. During these procedures, an anesthesiologist, or CRNA, will be next to you during the procedure to monitor your blood pressure, your heart rate, and your breathing pattern. You will meet with an anesthesiologist or CRNA beforehand to discuss your history. You will also meet with the physician performing your procedure, as well as the assisting fellow, physician assistant, or nurse practitioner. You will sign a formal consent form after discussing the risks of the procedure and after meeting with your entire team. The risks of this device implantation are very rare, however, they are important to review. You will have a lead or a wire implanted underneath your skin on top of your sternum or your breastbone, which will be connected to a battery or a generator, which will be placed alongside your rib cage underneath your left arm. The lead and battery will be secured to the muscle underneath the skin, and you will have 2 incision sites, one on the front of your chest, which is very small, and the other underneath the left arm, which will be larger. The skin will then be closed with absorbable sutures, and you will go home with a dressing on your chest. On the rare occasion, staples may be used to close your incision site. These will be removed 2 weeks after your procedure at a follow-up appointment. You will then have a second follow-up appointment 6 to 12 weeks after your procedure. There is a risk of some pain or discomfort at the incision site, bleeding, infection, and swelling. We recommend you don't do anything for 1 to 2 weeks that would cause the incision sites to stretch. A separate video discusses all of the restrictions you will need to follow after your procedure. Additional procedural complications that can occur include stroke, heart attack, and death in extremely rare cases. It is important to mention that each of these risks are very rare, and your care team is well equipped to address any potential complication that may occur. Some patients are discharged the same day as their procedure, depending on the time their case finished, how long the procedure took, and how you feel after the procedure. If you meet our criteria for a safe discharge, you may be sent home the same day. Otherwise, you will be kept overnight for monitoring and likely discharged the following day. It is important to mention that under no circumstance can you drive yourself to the hospital for your procedure. You cannot drive for 2 weeks after a device implantation. Under certain circumstances, it is Massachusetts state law that you cannot drive for a full 6 months after your device implant if you have ever passed out and lost consciousness as a result of your abnormal heart rate. Regarding travel after your procedure, this will be up to your doctor based on your particular case. If you have planned to travel shortly after your procedure, please let your doctor know beforehand. If you go home the same day as your procedure, you must have an adult who will escort you home after the procedure. You will also need to have an adult stay with you at home overnight. This person will also need to be available to review your discharge instructions in person, as you will just be waking up from surgery. A physician assistant or nurse practitioner from our team will see you prior to your discharge and will review all of your medications and any new prescriptions that you might need. If you do end up staying overnight in the hospital, you will usually be discharged the next morning. If you are discharged the same day, someone from our device team will call you the following day to check in and see how you're feeling. They will ask about your device implantation site, your prescriptions, and will review a remote transmission from your device to ensure everything is functioning properly. You will be discharged home with either a remote monitor to keep plugged in at your bedside table at home, or you will be set up with a phone app that is able to monitor your device. A representative from the manufacturing company of your device will then review instructions on your home monitoring before you leave the hospital. You will then have a follow-up visit with your doctor or their advanced practice provider in the office in 6 to 12 weeks. If you have any general questions, you may call the office at 617-724-4500 between the hours of 8:30 a.m. and 4 p.m., or you can send a message through Patient Gateway. Please note, we do not check Gateway messages overnight or on weekends.